Hello everybody, my name is Leo and this is my partner Sarah. We're going to be presenting on the integumentary system and Sarah's going to kick it off for us.
Okay, so starting off, we're going to go ahead and start it with our video.
Oh my god. I apologize.
Okay, so that was a quick little introduction to the integumentary system. So what is the integumentary system? It is made up of the several organs and structures, including your hair, skin, nails, glands, and nerves. It protects your body from infection, extreme temperature. It helps you maintain homeostasis with the balance of fluids, and also synthesizes vitamin D. It has 3 layers: the epidermis, which is the top layer, the dermis, and then the hypodermis, which is the bottom layer. Here is just a kind of diagram of the integumentary system, kind of just a small portion, just like the skin. So you can see the epidermis, which is a top thin layer. You can see the dermis, which is this big layer right here, and then the hypodermis, which is full of adipose tissue. And you are also able to see the arteries, the veins, the sweat glands within the dermis, as well as different other glands. Hair follicles are also included. This is just also the hair shaft, the sweat pore on the epidermis, and then it shows you the different layers of the epidermis as well, which we're going to go over. So just to kind of go deeper into the functions of this system, it provides protection. So your skin is the first front line of protection that your body has. It protects you from water, sunlight, friction. It acts as a protective barrier against water loss. And there are keratin and glycolipids within the epidermis. And keratin is your main protein in your skin. It makes up for the hair and nails. It's what makes your skin rigid. So the stratum corneum is the top layer of the epidermis, and this layer prevents unwanted materials from entering your body. The integumentary system also has a function of sensory, which is because the epidermis, dermis, and hypodermis contain specialized nerve structures that detect touch, temperature, as well as pain. These receptors are more sensitive on your fingertips, and that's where your touch is most sensitive. There are also sensory nerves connected to each hair follicle and temperature receptors scattered throughout the skin. So thermoregulation helps the body regulate body temperature. So it interacts with your sympathetic nervous system, so your fight or flight response. Thermoregulation is kind of like when your body is too hot, your body starts to sweat, try to cool the body down. Same type of deal when you break a fever, your body gets too hot, so your body starts to sweat, trying to get that fever down. Your blood vessels also dilate when the outside temperature is too high. This brings more blood to the body's surface to cool it off. Vitamin D synthesis is also very important, and this happens when exposed to UV radiation. Vitamin D is essential for absorption of calcium and phosphorus, which are required for healthy bones. So going a little bit deeper, the epidermis is going to be the top superficial layer of your skin. It contains cells like keratinocytes, and the keratinocytes is what are tiny little they're tiny little basic cells that come together and make keratin, which provides the structure, durability, and waterproofing of your hair, nails, and outer skin. You also have melanocytes, which synthesize melanin, which gives your skin color. Langerhans cells, which ingest unwanted invaders. The Langerhans cells are your immune system they're cells from the immune system that help your skin get a head start, pretty much. Merkel cells combine with nerve endings to create sensory receptor to touch. The main purpose of the epidermis is to provide protection, absorb nutrients, and homeostasis, again, because it is the first superficial layer that comes into contact with everything first, before the dermis and the hypodermis, and helps keep homeostasis, which is the maintenance, regulation, and stability and consistency needed to provide proper body function. The dermis. The dermis is a layer underneath the epidermis. It provides support and cushioning. It's composed of collagen. Collagen is a protein of the human body that holds the layers of the skin together. It also contains phagocytes, and phagocytes are cells that consume harmful toxins and bacteria. So pretty much whatever the previous slide, the Langerhans cells don't catch, the phagocytes will try to. And this dermis is what's full of capillaries and blood vessels, as we saw in that first diagram. The dermis also provides heal wounding. Whenever skin is damaged, it gets the dermis job to heal the area, and this process is called scar forming. And lastly, the hypodermis is a basal layer, and it consists of adipose tissue, which is pretty much fat, because fat is really good at energy storage, insulation, shock absorption. It helps anchor the skin down. So again, this is just kind of showing the different layers of the skin. The epidermis is going to be the top layer, the dermis is going to be the middle layer, and the subcutaneous tissue is pretty much the hypodermis. And you can see the adipose right here.
And I wanted to add a little bit to what Sarah said, the homeostasis. She really touched on how it all works together and it intercombines. If you go ahead and go to the previous slide for me, please. As you can see, she really touched on it, and pretty much the homeostasis is just kind of like an equilibrium in your body. And as you can see right here, how the temperatures kind of work together and collide. Just wanted to briefly just touch on that.
Perfect. Again, this is just another diagram showing the layers of the skin. The epidermis has multiple layers: the stratum corneum, stratum lucidum, stratum granuloseum, stratum spinosum, stratum basal, and then there's a papillary region. There wasn't really enough time to go over each layer, but these all have their own little function. The epidermis is going to be the superficial layer, dermis, medium depth, and then this part of the dermis, and the hypodermis is a deep depth. Whenever there is a cut that goes deep, it's going to take a little bit longer to heal. And then Leo's going to go ahead and go over aging with you guys.
Are you able to go to the next slide? Because I'm not able to.
Is it not?
Thank you. Oh, wait. It went back.
This is the first slide.
Okay, yes. Okay, before I begin, I just want to let you guys know that I am a little sick, so please bear with me, but let's get into aging. Aging is a very, very important thing for the integumentary system. Let me just kind of read off the slide. As somebody grows older, the skin becomes more thin and fragile. That's a very common thing with the integumentary system. Extrinsic aging caused by external factors such as exposure, radiation, or toxic substances. These can be like ultraviolet radiations or lights such as like the sun. And then in addition to that, cigarette smoking and air pollution, those can really harm your integumentary system, meaning your skin. And then it also comes with an intrinsic aging. The definition is just aging caused by internal factors related to degeneration of psychological processes. So as skin, as you age, your skin becomes more wrinkly and it's more easily damaged. And like as well, like the ability for your skin to heal, that just comes obviously with age. And then right here it says a decrease in elasticity and then just thinning. And then with this, it actually puts you at a higher risk of pressure injuries, skin tearing, shearing, and ulcers, diabetes, also with hair loss because your integumentary system is hair, nails, skin, etc. So yeah, can you go on the next slide for me, please? Now this is just like a continuation, goes into depth of like the different systems. So let's start with epidermis. Epidermis is the outermost layer of your skin, so it's gonna be less moisture, and then the mitosis slows down. I wanted to briefly touch on what Sarah was talking about in her part when she spoke about collagen. As you guys probably know, collagen is a major part in like skincare. It's on all of our skincare bottles. Collagen is just like this, like I wouldn't know if it's like an enzyme, but it's kind of like what really protects and holds your skin. So as aging, you're gonna lose more collagen.
And that's gonna be related to the dermis.
Yes, and then so the dermis, it's gonna come with like elastic, like loosening, collagen loosening, decrease in vascularity, and then obviously thinning, and then hair. You're gonna lose your hair, unfortunately. Your hair follicles just become more thin and weaker, and then lastly, or second to last, your nails are just going to become more dull, yellow, and gray. Obviously losing its like structure. Lastly, glands, they're going to become dull yellow and then like a gray colorish. The growth of your glands are going to slow down dramatically. And then
just to retouch up on here a little bit, with your hair, you're also going to have a decrease in hormones, which will lead to facial hair in women. It's really common for older residents to have hair in their ears and nose, as well as balding. Just wanted to touch up on that and related to like how hormones and hair work together as you age.
And then next up we have interventions. Some interventions that we can do is bathing residents regularly. Bathing just promotes hydration, and then going into moisturizing the skin. Honestly, like when I'm at the facility, I moisturize them with lotion, and that will obviously enhance their epidermis. But it's always good to remind ourselves to not apply lotion between toes and underneath skin folds for obvious reasons. Another intervention is making sure residents' linen is wrinkle free. This will reduce skin irritation or essentially pressure. Another one is patient repositioning and turning, reminding that we're turning them every 2 hours. This will prevent pressure injuries for sure. And then just kind of repositioning them. Oh, it went to the next slide. Oh wait, no. Oh my god,
It's
never
still
mind.
on interventions for me.
Wait, can you go back to interventions? I apologize.
It's on interventions.
Oh my god, on my screen it's on. Okay, yeah, there you go. Oh. Sorry, I think it's just lagging on my end. So we'll be back to interventions shortly, but these are just some okay, yes. Oh. So the next one for interventions was using the draw sheet. Whenever you're moving residents, make sure we're using the draw sheet to protect their skin, proper nutrition and fluid intake, and then taking proper precautions will definitely be some major interventions for this. Okay, next slide, please. Now, some reportable interventions. I'm just going to go briefly on the list. These are some very, very reportable ones that we want to do. Rashes, bruising, pressure injuries, redness, blisters, ulcers, dry skins, infections, fevers, cold sweat, any bleeding, irritations with IV catheters. These are major, major reports we always want to do as CNAs and nurses, just because this will really, really affect their integumentary system, regardless of which layer it's affecting, just because as we discussed,
it could always get worse.
It could.
So as far as pressure injuries go, with the different levels, as nursing assistants, we won't be able to do much as diagnosing what kind of level it is. But it's really just as the same thing with if the IV or catheter is irritated, the only thing you can really do is report that to the charge nurse. But that's why it's so important to make sure that you're paying attention to your resident's skin and reporting and documenting any changes, so that way the charge nurse is made aware of it, and we can prevent further irritation, further injury, and just keep it from getting worse as a whole.
Thank you, Sarah.
When it comes to the integumentary system, there are many common skin diseases. This specific study followed a birth cohort aged 70 and above, focusing on the geriatric population in many nursing homes and acute facilities. The study found that the three most common skin diseases were eczema, skin infections, pruritus, severely dry and itchy skin. The study found that 76% of the population had one or more of the top three or the following, meaning that 76% of this population had one or more of these skin issues. The geriatric population is a very high risk. If we look, 76% is a lot, and it's very important that we keep an eye out for these different skin issues because of the severity they can get if they go untreated. Back to the study, besides the eczema, skin infections, or pruritus, they also found that one of the other common diseases were rosacea, a condition that causes people to blush or flush easily, found in 25%, eczema, characterized by dry, itchy, and cracked skin, found in 21%, seborrheic dermatitis, which causes dandruff, found in 10%, pneumolarea eczema, which features coin-shaped, itchy, reddened patches, found in 9%. Previously undiagnosed actinic keratosis, tongue twister, a precancerous skin lesion, found in 22%. Like I said, the geriatric population is a very high risk for skin issues, and it's important to keep this in mind when caring for patients, and we want to be constantly observant of these irregularities, as they could lead to severe issues in the future. As I said, there are many common diseases, but today I'm going to be focusing on eczema, atopic dermatitis. Eczema is the most common chronic inflammatory disease, and that's why I chose it today. It's characterized by red, itchy inflammation of the skin, and it tends to be passed on by parents. While the pathophysiology is not completely understood, there are numerous studies that point to skin barrier dysfunction and immune deregulation. The epidermis plays a crucial role in the physical and functional barrier. Skin barrier defects disturb proteins that are responsible for proper epidermis function, including facilitating allergen and microbial penetration to the skin. Basically meaning that the epidermis requires specific proteins, and when there are defects that disturb these proteins, the epidermis isn't capable of properly protecting itself, and then that leads to allergens and irritants that are easily penetrating the skin that lead to the result of eczema, which is the inflammation, the irritation, and the dry patches, etc. As for immune dysregulation, it's a result in impairment of the epidermal layer, specifically in the lipid layer. So this can be either to old age or maybe they have immune deficiency, but when there is an inability to have that immunity, the epidermal layer weakens, specifically in the lipid layer, studies have shown. They're not completely sure if it's the lipid layer, but so far that's what the studies have shown. But again, leads to not being able to protect itself properly from allergens and irritants, and again, leading to eczema, the red and itchy skin. Genetics are also to blame. Many studies have shown that FLG null mutations impair skin barrier function and increase risk for AD, as well as homogeneous mutations. So if it's not skin barrier dysfunction, immune deregulation, most likely they have a genetic disparity. It's very common if your parents have it, or maybe your grandparents, that you can get it as well. And maybe it'll be small at first, but it's even more common to show up in either early age or later age. Signs and symptoms of the disease: dry skin, red irritated inflammation, red to brown extreme dry patches, especially around the ankles, wrists, hands, feet, neck, upper chest, eyelids, inside bend of elbows, knees, face, and scalp. A lot of the folded areas that have a lot of friction, or places that we don't tend to moisturize as well. So got to keep in mind of these specific areas when caring for geriatric patients. Itching, especially at night, small raised bumps, which may leak fluid in extreme cases, thickened, cracked, scaly skin, raw, sensitive, swollen skin from scratching. As for diagnosis and treatment, there is no lab tests necessary to diagnose eczema. Doctors can identify eczema by sight. They look for the symptoms. They can review your medical history. But it's a pretty visual disease, so it does make it easier to diagnose in that sense. But there are also many different types of skin diseases, so there is patch testing for that, which can rule out other skin diseases and point specifically to eczema. If regular moisturizing and self-care does not help, your doctor may recommend one or more of the following treatments. The most common would be medications. First off, very common, corticosteroid cream or ointment. This would be your first bet. Next up is antibiotic creams or oil antibiotics, but this is not just for the eczema itself, but if they have cracked or open skin or sores, doctor would prescribe this to limit infection, because that is such a huge risk with eczema patients because of cracked skin, open wounds. Next up is oral corticosteroids. This is mainly used in severe cases if other treatments aren't working as well, only because there are risks of skin specific cancers and other what's the word? I can't. Oh, side effects. There we go. There are a lot of negative side effects with these oral corticosteroids. So it's a cost. Basically, a pro. You got to weigh your pros and cons here if you're willing to risk these side effects if the disease is that severe. Next up, this is a new concept, injectable biologics. These are used specifically in severe cases if you do not react well to other treatments, but the downside is that it's very expensive, which is very common with a lot of new pharmaceuticals. Because when treatments are new, they have to get approved by insurance to be covered, and that can take years and sometimes multiple studies and different things like that. So it is an effective option, but you're going to have to pay out of pocket. Next up for treatments, we have therapies. Wet dressings is an effective treatment that involves wrapping the affected area in corticosteroid cream and wet bandages. But this does require a nursing expertise, and that's why it's commonly done in hospitals and acute facilities, nursing homes, because it requires that nursing expertise, but can be very effective. Light therapy is an outdated practice because of premature skin aging and skin cancer risks, but it is an honorable mention because it can be effective, but it does involve exposing the skin to controlled amounts of natural light or artificial ultraviolet lights. There are many different types of light therapy, but those are just two examples. Counseling may help patients cope with frustrations of the disease because this is a lifelong disease and there is no cure. It can be very frustrating and almost hopeless, so counseling can be very beneficial to these patients. Relaxation and behavior modification may help people who scratch regularly. Nursing interventions, we want to be assessing the skin for color, texture, moisture, temperature, and tenderness, any kind of irregularities that aren't normal or natural. We want to catch them in their tracks early on before they become more severe. We want to assess the skin systematically, checking areas of irritant and allergic contact, and not forgetting the areas that I mentioned earlier in the slides: the knees, the hands, the wrists, the feet, the ankles, the neck, the scalp, skin folds, all those areas. We want to be sure we're checking very carefully and being very observant. Assess for open skin lesions or thickening, result of scratching, but these are high risk for infection, so we want to be sure we're keeping an eye out for open wounds and protecting our patients from infection. Identify aggravating factors: soaps, laundry products, cosmetics, fibers, cleaning products, etc. Basically any type of irritant that could possibly have odors, chemicals, things that our body's not used to or natural that could irritate the skin, and possibly removing those from the patient's daily routine, or at least advocating for it. Encourage patients to adopt skincare routines to decrease skin irritation, or implementing these into our care routines when we're caring for patients, our residents. Bathe in lukewarm water. mild soaps or non-soap cleansers. After bathing, allow skin to dry completely. Being sure to pat dry the skin. Apply topical lubricants immediately after bathing. Apply topical steroid creams and ointments. That is it for my common diseases, and now on to the presentation quiz. The dermis is A, the front line of protection, B, responsible for wound healing, C, responsible for homeostasis, D, all of the above. B, wound healing. These are frontline of protection and responsible homeostasis. These are jobs of the skin, but not specifically the epidermis. Not specifically the dermis. These are jobs of the epidermis. Sorry. The hypodermis consists of A, blood vessels, B, collagen, C, adipose tissue, D, all of the above. The answer is C, adipose tissue. This is a fancy word for fat. So this is the third layer of the skin, and which mainly consists of fat. Question 3, an example of intrinsic aging is A, the ability to heal itself decreases as skin ages. B, lifelong smoker. C, living in a high air pollution. D, all of the above. The answer is A, the ability for the skin to heal itself as skin ages. These other two examples are examples of not intrinsic aging, but extrinsic aging, which are external factors, not internal factors. Question 4, which is not within the epidermis? A, melanocytes, synthesizes melanin, the pigment that gives skin color. B, collagen. C, Langerhans cells ingest unwanted invaders. D, Merkel cells. The answer is B, collagen. These are different parts of different layers, not the epidermis. Final question, question 5. The biggest concern with open wounds, skin, is A, pressure injuries, B, skin tearing, C, infection, D, all of the above. Now this is a pretty easy one if you've been listening to me. Infection, talked about this a lot. When it comes to skin issues, we want to be very aware of open wounds, cuts, scrapes, cracked skin, because those are perfect little holes for infection. And that is it for our presentation. These are our sources, and thank you for listening to our presentation on the integumentary system.